بسم الله الرحمن الرحيم. صلي وسلم على اشرف الله محمد بن عبد الله وعلى اله وصحبه. السلام عليكم ورحمه الله. Inshallah, today I will present the imaging of male reproductive system. Last week we discussed the female reproductive system. The imaging modalities that perform to assess the system include ultrasound, CT, MRI, nuclear medicine review, isotope studies, and angiography. But for the scrotum content, especially the testes and epididymis, the ultrasound play a very important role in assessment of this content. And sometimes MRI may be requested for in case if the ultrasound result is inconclusive or if ultrasound احتمال تكون not available, but the ultrasound play a very important role in assessment. Sometimes MRI may be added. Why ultrasound and MRI usually used for assessment of this part? Because both MRI and ultrasound use no ionizing radiation, and all of you know that the testes are very sensitive for the radiation. حتى احنا إذا نعمل X-ray for the pelvis, the testes usually cover يعني shield to protect them from radiation. So for assessment of the scrotum, usually we use either ultrasound as an initial imaging modality, and then MRI. The most common indication for scrotal ultrasound may be scrotal swelling or scrotal pain. What are the differential diagnoses of scrotal pain and scrotal swelling? If the patient presents with scrotal pain and scrotal swelling, what may be the cause? Or what are the differential diagnoses? What conditions or pathologies that causing scrotal pain and scrotal swelling? Any volunteer? Scrotal pain or scrotal swelling may be caused by orchitis or epididymitis or epididymorchitis or testicular torsion. But there are other, but these are the most they are the most common causes of this clinical presentation. Which one of these is very dangerous and carry more hazard for the patient? Yes, a volunteer. Testicular torsion. Testicular torsion.
Testicular torsion.
Yes, testicular torsion should be excluded. Why? Because if not treated earlier, it may end by loss of the testes. So this condition or this pathology should be excluded. And what imaging technique that can be used for differentiation between the testicular torsion and others? نعمل ايش؟ what
Doppler ultrasound.
Yes, Doppler ultrasound. Why? Because we are interested in the blood supply of vascularity, as testicular torsion
Doppler
characterized
ultrasound.
by Doppler ultrasound, because testicular torsion characterized by impairment of the blood flow due to twisting of the arteries. So the double ultrasound used for assessment of the blood flow to the testes to diagnose this testicular torsion. As we mentioned, MRI may be used in case if there is if the ultrasound is not is inconclusive, or يعني the result is not sufficient, or the information is not sufficient enough. In this time you can do MRI for further investigation. In color in the ultrasound، أول شيء تعرف إنه الالتراساوند دي عندنا two types. واحدة بتكون black and white يسموها gray scale، زي دي gray scale يسموها شنو؟ black and white. الأذر واحدة اسمها color doubler. color doubler فرق بيناتهم إنه color doubler used for assessment of the blood flow, and also it can be used for assessment of the morphology. color doubler ultrasound, but black and white used for assessment of the morphology and texture and echogenicity. It has no any role in assessment of the blood flow within any structure. Normal intertesticular blood flow can be demonstrated by the color doubler and power doubler. Color doubler and power doubler are the techniques that used by the color doubler technique. إذا نعرف إن إحنا عندنا color doubler ultrasound and black and white ultrasound. In color doubler ultrasound used for assessment of the blood flow within any structure. مثلا this test is. فالآن this is a black and white ultrasound. There is no color flow. There is no color. يعني في box كده بنعمله هنا around the structure of interest to assess the blood supply. But this is the normal testes which are ovoid shape of intermediate hyperechoic، يعني ما hyperechoic شديد، يعني intermediate hyperechoic oval in shape measuring about 2 by 3 by 5 in the adult people. Also, this is the ultrasound for the testes. This is the testes, and this is testes, and this is the epididymis. Epididymis and this head, neck, and tail, head, body, and tail. This is epididymis, and also this is epididymis, but this is the testes. Homogeneous in texture. Homogeneous in texture. This is the normal appearance. قلنا عندنا حاجة اسمها color double. لما تلقى البوكس دي البوكس ده عندنا نوب معين بنعمل عليه when we press this بيظهر لك البوكس ده بتحوله على حسب الاريا. مثلا انا شفت assess blood supply or blood vascularity in this area, we put this box on the مثلا the testes and you look within the box. If there is a red and blue color within this area, this is indicating there is a flow. There is a flow of the blood or there is a vascularity. This is a normal flowing of the vascularity of the testes, evident by color double ultrasound. But this is color double ultrasound. This is not grayscale or black and white ultrasound. So color double ultrasound used for assessment of the vascularity, to assess the blood vessels or blood flow within the structure. The prostate can be assessed by ultrasound or CT or MRI. Ultrasound can be done with two techniques, by transabdominal ultrasounds such as this or transrectal ultrasound. Both are ultrasound, but the technique is different from each other. يعني مثلا this transabdominal. In transabdominal, we put the transducer in the anterior abdominal wall to assess the prostate. And you can look, the urea bladder should be full to assess the prostate by the transabdominal ultrasound. In contrast, in transrectal ultrasound, the urea bladder should be empty, and we insert the transducer through the rectum to assess the prostate. This is the prostate, and this is the prostate by the transabdominal ultrasound, and this is the urea bladder, and this is transrectal. This rectal ultrasound can show the the size and shape of the prostate and can diagnose a lesion within the prostate. Even a small lesion can be demonstrated by this, transrectal ultrasound. And also this transrectal ultrasound help us in taking a biopsy to guide taking biopsy from the lesion. سي تي يعني هي ما بنستخدمها كثير لأن هي give us poor assessment of the prostate zone. لأنه عارفين البروستات زون عندها transition zone, peripheral zone and central zone. But this CT cannot differentiate between the different zones of the prostate. لذلك احنا ما بنعملها commonly this CT for assessment of the prostatic lesion. Although it can help us in the assessment of local invasion of the adjacent tissue by the malignancy. يعني إذا عندنا prostatic malignancy, CT can demonstrate the invasion of the adjacent structure by this tumor, and also can demonstrate the lymphadenopathy. لكن هي for the prostate itself give us poor zonal anatomy. لذلك عندنا MRI دي هي the preferred image for assessment of the prostate. And it is used and can demonstrate the prostate and can demonstrate the lesion if there is a benign or malignant lesion, and also can be used for assessment of the distant metastasis in the lymph node or extracapsular tumor spread to the adjacent structure or distantly. So MRI now is preferred imaging modality for assessment of the prostate. This is CT. ليش واضح إنه this is CT axial. You can see this is the posterior and this is the anterior. This is the back and this is the anterior abdominal wall. This is left and this is the right for the orientation. This is the urea bladder. So this is the prostate and this is the rectum. You can see the air within the rectum. This is the rectum and this is the prostate. And the zonal anatomy is not clear. You are not able to differentiate between the different zones. The peripheral zone from the transition zone from the central zone. So the prostate appears as an ovular soft tissue density, and it is region here at the base of the urinary bladder and surrounded by the fascia and muscle. So this is CT demonstrate how this prostate zonal anatomy is very poor. Right. Now we're going to discuss some abnormality. We start with hydrocele. Hydrocele means from its name, كلمة hydro دائما طبعا معروف إنها fluid. But this is the accumulation of fluid in the sac, in the between the layers of tunica vaginalis. Usually it is a painless accumulation of fluid. Within when? بتكون موجودة وين? In the sac around one or both testicles between the layer of the tunica vaginalis. أول شيء لازم تكونوا متذكرين إنه دائما الفلويد in ultrasound appear black. نسميها anechoic, totally black, أسود مرة, totally black. This is fluid. But this is the testis. إذا رجعت للultrasound, this is there is no fluid surrounding the testis. But in this one, you can see there is a fluid. There is a fluid around the testis and around the epididymis. This is a fluid called hydrocele. The causes of hydrocele may be divided into two groups: congenital or acquired. May be caused by the inflammatory condition, granulomatous condition, abscess or epididymitis or orchitis. يسموها reactive hydrocele حنجي نتكلم عنها. Or it may be due to vascular causes, hematoma or infarction, or may be associated with tumors, such as benign tumor or malignant tumor, and also it may be idiopathic, which is the most common, without any cause. How to diagnose this hydrocele? عرفنا definition والcause. But usually the patient presents with painless swelling of the affected scrotum. يعني مثلا يكون عنده left swelling of the scrotum, usually painless. swelling of the affected scrotum. طبعا بعد ذاك the physician بيعمل examination for the patient uh, uh, and then the diagnosis usually is clinically. طبعا في diagnosis في الانسبكشن وبالبيشن وفي حتى حاجه اسمها transillumination by passing light through the the scrotum. If this patient presents with this painless swelling, and the diagnosis usually clinically diagnosis. نسينا نقول لكم انه this hydrocele may be seen in infancy or childhood وممكن تجي in adult برضه طبعا. طيب بعد ما عملنا clinical diagnosis according to the presentation, then the patient should be imaged by ultrasound. Ultrasound قلنا هي دائما بنستخدم في ultrasound for assessment of the scrotum. فhow this hydrocele appear? If you look at this image, hydrocele appear as hypo or anechoic fluid. يعني black. hypo احيانا بيكون مره black يعني هي fluid، لكن حاليا نتكلم عن هي عندنا different types of of hydrocele. But this is hypo or anechoic fluid around the testis. This is a fluid around the testis, and this is a fluid around the testis. This is the hydrocele. So this is ultrasound demonstrate the fluid surrounding the testis. So this is the hydrocele. Look, the fluid here is totally black. There is no there is no echoes or there is no any يعني septation. Totally clear fluid. This type يسموها simple hydrocele. So in simple hydrocele the fluid will be totally black. There is no any echoes يعني ما في منطقة بيضاء أو there is no any septation ما في أي حواجز كده. But this is called simple hydrocele. And also the testes appear normal يعني there is no any focal lesion or يعني enlarged testes. There is no any abnormal in the testes. دي بنسميها simple hydrocele. But in this one there is a fluid around the testes. This is a fluid اللي هو hydrocele, and this is a testis, and this is the epididymis. If you look, the epididymis here is not it is not normal. It is bulky with heterogeneous texture. فلما يكون عندنا hydrocele with abnormal epididymis or or testis دي بنسميها انه reactive hydrocele. بس هو hydrocele with abnormal testis or epididymis بنسميها reactive hydrocele. بس هو this is simple. Why this is simple? لأنه there is no echoes within the fluid and the testis is normal. It's not of normal texture, no any abnormality, and the fluid is clear fluid. There is no echoes within. But this is simple hydrocele. In this one, you can see the epididymis appear normal, but the fluid itself is not normal. It is not clear fluid. لاحظ انه فيها شنو التير بنقول there is internal echoes and septation. Internal echoes and internal sorry for the interruption. الصوت مسموع كده؟ واضح الصوت؟
أيوة. Yes.
واضح.
So when the fluid or the hydrocele shows septation like this is called septum or septi. There are multiple septation or internal echoes. It is not pure fluid similar to this. So this is called complex hydrocele. So the hydrocele divided into three types. Simple hydrocele when the fluid is pure, totally hypoechoic or anechoic with normal testes and epididymis. And in reactive hydrocele, the testes or the epididymis may be abnormal. In this time بنسميها شنو reactive hydrocele associated with abnormal epididymis or testes. We call it reactive hydrocele. And the third type is called complex hydrocele, in which the fluid shows internal echoes or septation. This is called complex hydrocele. The next abnormality we are going to discuss is varicocele. Varicocele is the abnormal dilated bambinophore plexus اللي هي venous plexus اللي هي شنو of the the testes. فnormally the diameter of the testicular vein bambinophore plexus here about 3 millimeter. About 3 millimeter. When this diameter of the this vein is more than 3 millimeter, it's considered enlarged or dilated, vein. The patient with varicocele present with scrotal swelling and pain, and sometimes testicular atrophy in long-standing varicocele, and also it may end by infertility or subfertility if it is not treated early. Like if the patient present early, he may present with scrotal swelling and scrotal pain. And كل ما يتأخر طبعا بيحصل شنو complication. ممكن يجي testicular atrophy, small testes, or infertility. So it should be also treated earlier to prevent this complication. How to diagnose؟ طبعا هو البيشنت بيجي بالسوالينج دي، بيعمل the physician take the history and then examine the patient. Then he requests the ultrasound. So the ultrasound is the diagnostic modality of choice. Any patient suspected varicocele, the ultrasound should be done. How this varicocele appear on ultrasound؟ أول شيء دي زي ما اتفقنا إنه this is black and white ultrasound. A gray scale ultrasound. This is a testis and this is a testis. And you can see there is abnormal dilated veins in this area. But this is dilated veins. Bambiniform plexus are dilated. But this is a dilated vein. فإذا this varicocele characterized by dilatation of bambiniform plexus اللي هي دي. This dilatation increase with Valsalva maneuver. اللي هي Valsalva maneuver زي ما انتم عارفين اللي هي done by the health provider or by the operator يعني in this case, by asking the patient to take deep breaths and then hold it and bear down. اللي هي تقريبا similar to the to the pressure during the bowel movement. The patient take deep breaths and then hold it and bear down. They'll come during the the bowel movement, and this is called Valsalva maneuver. And at this time there is an increased blood flow and the bambinophore plexus appear more in this Valsalva maneuver. فإذا الإكزامينر أو الأوبريتور بالالتراساوند سكورتال ultrasound he can see these dilated veins within the scrotum, and then he asks the patient to take a deep breath and hold it اللي هي بالزافا maneuver, and in this time the dilated depth may be more apparent. Then بنيجي نعمل قلنا البوكس دي. this box عندنا نوب معين نعمل when we press it بيظهر لنا البوكس ده on the machine on the monitor, and then we move this monitor and put it at the area of the scroll of the testes or at the area of the مثلا هنا at the area of this dilated vein. لاحظ انه دي shows blood flow. فاذا بتعرف انه المنطقه دي هي دي vessels. ليش؟ لانه it shows flow blood flow. اذا ما كانت vessels ما كان حتصل لك فيها flow زي دي. So this color double ultrasound confirming this is this is a vascular structure. This is characteristically appear as serpiginous appearance. لاحظ انه appear as serpiginous appearance in ultrasound. So this is ultrasound black and white demonstrates this dilated bambinophore veins within the scrotum, and this shows more enlargement during the Valsalva maneuver, and with double ultrasound we confirm this is a vascular which appear as serpiginous appearance. طيب كنا أشرنا للأكيوت تيست acute scrotal condition. يبقى كان تكلمنا عنها إن differential diagnosis include orchitis, epididymitis, or both epididymorchitis or torsion. Torsion is very dangerous, so should be excluded. Any patient present with acute testicular acute testicular pain, painful scrotal condition, you have to exclude torsion. طيب هنيجي نشوف how to differentiate between these differential diagnoses or these causes. The first one is epididymitis. Epididymitis, patient present with scrotal pain and tenderness and high and severe febrile process, يعني fever. A patient present with mild tenderness, scrotal tenderness, and pain and febrile condition on his scrotal for acute acute history. طيب بعدك احنا زي ما قلنا هنضع الديفرنشال دياجنوزيس دي. هنعمل examination بطريقه معينه. هنعمل examination, then ultrasound should be performed. How the epididymitis appear on ultrasound. لما نعمل ultrasound زي ما اتفقنا قبل, this is a normal testis, this is a normal testis, this is a normal testis, and this is a normal testis. This is the epididymis. لكن if you ارجع لكم معلش ثاني عشان تتذكروا normal, this is a normal epididymis. لكن here the epididymis is appear bulkier. It is enlarged. The epididymis shows increase in size and appear hypoechoic. يعني المفروض الايكوجينيسيتي تكون similar to the testis, لكن هنا appear hypoechoic. So this is a bulky epididymis with يعني edematous and bulky with hypoechoic compared to the testis, and also this is a edematous epididymis with decreased echogenicity. This is a black and white ultrasound. With Doppler, you can see there is increased vascularity. يعني لاحظ انه الكلر red and blue color دي بقت more than normal. But this increase in there is a more vascularity in this area. لكن التستس normal في يعني normal flow, and also there is a normal flow in this, but there is more vascularity. In the increased vascularity by the Doppler on the area of the epididymis. So this is features of epididymitis on ultrasound, and also you can see there is a fluid here. يعني في fluid زي ما اتفقنا عليها, هي دي ايش بنسميها reactive hydrocele. هي hydrocele with abnormal epididymis. So epididymitis characterized by reactive hydrocele and uh, increased vascularity of the area of the epididymis, but the testis is normal. Testis is normal. آه طبعا اول شيء لابد نكون خدت في بالنا احنا you have to exclude testicular torsion. Now there is no evidence testicular torsion because the testis is normal in echogenicity and size and means color flow. There is no increase or decrease vascularity in the area of the testis. Like the other differential diagnosis of acute scrotal condition is architis. Also, the patient may present with scrotal pain and swelling, plus or minus high fever, plus or minus fever. The patient presentation history examination, then we have to do ultrasound. Ultrasound also is the gold standard imaging study for the architis. Look to this is a gray scale or black and white ultrasound. This is a normal testis, but this one is is يعني hypoechoic شوية يعني appear of less echogenicity. So on the orchitis, the affected testis appear hypoechoic and بتكون بيحصل لها sometimes بيحصل لها swelling برضه. So this is there is a focal or diffuse hypoechogenicity. أهم شيء بتكون hypoechoic يعني أكثر أسود سوداء أكثر من النورمال one. This is normal. This is hypoechoic. This hypoechogenicity may be focal or generalized or diffuse يعني. Then with color doubler حطينا البوكس دي box of the color doubler. It shows increased vascularity. لاحظوا كل areas of the testes shows increased vascularity. إذا رجعتوا لأي واحد مثلا هنا this is a normal تلقوا طلبت له vascularity normal لكن هنا exaggerated. There is more يعني hypervascularity. There is a hypervascularity in the area of the testis. So this is orchitis. So orchitis characterized by on ultrasound focal or diffuse hypoechogenicity يعني تبقى hypoechoic يعني more flat يعني with hypervascularity. In addition to this you can see the skin is thickened. The skin scrotal skin is thickened. Scrotal skin is thickened. See, these are the sign of orchitis. And also you can see there is a fluid. There is a hydrocele, active hydrocele. Active hydrocele. This is the fluid hydrocele. The طيب احيانا ممكن البيشنت يجيك ب complication in case if this مثلا orchitis or epididymal orchitis not treated, the patient may present with testicular abscess. Testicular abscess this is مثلا focal reduction in the echogenicity. They are focal, not generalized. But this focal region of decreased echogenicity. عملنا حطينا الدبلر. This is black and white and this is color double. حطينا البوكس دي. تلاحظ انه also there is a focal region of vascularity. المنطقة دي فيها الفاسكولاريتي أكثر من هنا normal. المنطقة دي normal لكن here there is a focal increase of vascularity. So this is features of abscess. So abscess present characterized by focal reduction of echogenicity with focal alteration of the vascularity. Here there is an increased vascularity focally with reduction of the focal echogenicity. This is a testicular abscess. طيب نجي الآن نتكلم عن ال very important one, testicular torsion. The patient presents with scrotal pain and or swelling. Most of the patient may be present with this testicular or the scrotal pain and swelling without any significant history of trauma يعني. May be spontaneous and sometimes may be minor or incidental trauma. يعني in about 5 to 8% of the cases they may be trauma. لذلك ما يعني the patient جاب acute testicular pain ما نقول ان البيشنت ده ما عنده history of trauma ومعناتها ما يكون testicular torsion. You have to exclude because many cases may be present with spontaneous history without any significant history of trauma, minor or يعني major trauma. So you have to exclude this testicular torsion, which is present with scrotal swelling and sudden severe testicular pain. طيب what are the features اللي هي sonographic feature of testicular torsion؟ هنعمل ultrasound زي ما اتفقنا. أي scrotal condition we start with ultrasound. Ultrasound is the modality of choice for evaluating this or to exclude this testicular torsion. أول شيء هو طبعا by definition testicular torsion بيكون عندنا impairment of blood supply. So with color Doppler ultrasound there is an absence of blood flow in both testes and epididymis. There is no blood flow. هتحط الcolor box there is no flow within the testes and epididymis. And these testes and epididymis becomes bulkier. There is increase in size of testes and epididymis. In the early stage, يعني in the first مثلا hours or the first days, there is the testes have a homogeneous texture. لكن late after مثلا 24 hours بيكون عندنا heterogeneous texture. طيب زي ما اتفقنا انه دائما مع الرياكتيف هيدروسيل بتكون اذا في abnormal testis or epididymis. Usually there is a reactive hydrocele with thickening of scrotal skin. أهم sign of the testicular torsion is absence of blood flow within the testis. This is a ultrasound color doubler. لاحظين تلقى البوكس دي وتلقى الكلر دي تعرف ان this is color doubler. So in this one there is increase of size of the testis, although there is no difference in the echogenicity with يعني without vascularity within the testis. يعني هي في يعني شوية يعني ممكن نقول لكن is not normal. There is a decreased vascularity, reduced vascularity in the affected testis, and this shows normal vascularity. So this is a testicular torsion. طيب anyone to comment on this one? Please. This patient presents with scrotal pain and scrotal swelling. How to report this image or how to interpret this image?
There is absence of blood flow.
Yeah, there is absence of blood flow.
And enlargement.
Yes, the testis appear enlarged. And with how about the echogenicity? Is it increase or decrease or normal؟ طبعا المفروض يكون في comparison فعلا. يعني هي المفروض نحن to compare between the other one لكن هو ما جايبين التو testes. دي الرايت ايوه دي الليفت. معناتها الاثنين there is a bilateral. يعني هنا absent. هنا absent the blood flow vascularity. This is the right and this is the left. Both shows absent blood flow. But this is the. طيب what is the diagnosis?
Testicular torsion.
Testicular torsion. Yeah, thank you. Also this is the color Doppler ultrasound demonstrate absence of blood flow within the testis. يلاحظ ان blood flow vascularity out of the area of the testis. لكن within the testis there is no flow. But this is the testicular torsion. In this one, this is the left testis and this is the right one. The left one يعني shows normal blood flow but in the other one there is exaggerated or there is increased vascularity. بيجت مرة كثيرة الكلر دي. This is means this is the orchitis. Orchitis characterized. أهم شيء احنا بنعتمد على شنو؟ على الكلر الفاسكولاريتي، يعني to differentiate between orchitis and epididymal orchitis and the testicular torsion. We depend mainly on the color, on the vascularity. In addition to this, you can look to the size and the echogenicity and the skin and the hydrocele. But the vascularity is the main difference. يعني we depend on it to differentiate between the different differential diagnosis. Now we're going to talk about the ectopic testis. Ectopic testis during development the testis بيحصل لها descending to be in the scrotum. Sometimes it may be arrested in the abdomen, the inguinal canal, in the perineal area, but this is called ectopic testis. To diagnose ectopic testis, also you have to start with ultrasound. Ultrasound can diagnose this ectopic testis, can localize this undescended testis in the inguinal canal or in the perineum or but if the ultrasound is not, it is inconclusive in diagnosis of the ectopic testis, or if the testis in the abdomen, and ultrasound يعني difficult to localize the testis in the abdomen لأنه في الباول كده، والالتراساوند دايما عندنا مشكلة مع الجازز، الباول فيها جازز، فلذلك أحيانا بيكون أو usually بيكون there is a difficulty in localizing the ectopic testis in the abdomen. So ultrasound is a good imaging technique for localizing the testis within the inguinal canal or in the perineum, but in the abdomen, not good. يعني can miss or cannot localize this, ectopic testis. In this time, you can do, MRI. MRI. And this is a patient present with empty scrotum. And empty scrotum معناته this is a, ectopic testis or undescended testis. This is a testis. This is a normal appearance of the testis within the inguinal canal. This is undescended testis demonstrated by the ultrasound in the inguinal canal. This is inguinal canal, and this is the testis. This is MRI. The left and the right, the left femur and the right femur, and the rear bladder, the posterior, the anterior. This is the testis. This patient presents with empty scrotum bilaterally, and you can see the testis within the inguinal canal. So this is the undescended bilateral and descending testis in the inguinal canal. This is the right one and this is the left one. لذلك انه التراساوند هسه دي الان ممكن البيشنت يكون عمل لها التراساوند كان بي this undescended testis can be demonstrated by ultrasound. وإذا عملت ultrasound MRI also can demonstrate، لكن usually we start with ultrasound for the undescended testes. طيب prosthetic calcification كان تقريبا تكلمنا عنها شوية in the renal system, but is most common finding in older men. يعني عندنا prosthetic calcification, and this calcification of the prostate show no correlation with prosthetic hypertrophy. يعني ما مثلا لقينا prosthetic calcification, this meaning there is a more prosthetic hypertrophy or more symptoms, and it is not correlated with the prosthetic enlargement, and it has no relation to prosthetic carcinoma. How this prosthetic calcification appear on the imaging? طيب طبعا بتتذكروا دائما ان الكالسيفيكيشن دي can be seen by اي موديل تستخدم X-ray. There is X-ray, conventional X-ray and CT. But this and also ultrasound can demonstrate this calcification. لكن ال MRI very poor in demonstration of calcification. Prosthetic calcification characterized by flex of calcification of different sizes, usually symmetrical, يعني between the right and left and in the midline. يعني this is the flex of calcification in the midline symmetrical. لاحظ انها symmetrical in distribution in the midline at the base of the area of the base of the urinary bladder. But this is the area of the prostate. This is the calcification. لما نقول calcification معناتها هيظهر لك زي البون، يعني تظهر لك opacity or density, hyper dense or opaque. But this is the calcification at the area of the prostate. But this is the prostatic calcification in this X-ray of the pelvis. نتكلم شوية كده عن testicular tumors. Testicular tumors most commonly seen in men between 20 and 35 years age, and it is the most common solid malignancy in this group. Most common solid tumor in the patient between 20 and 35 is the testicular tumor. طيب patient present with what? Patient إذا كان testicular tumor present with painless nodule or swelling of the testes. يعني ممكن يعمل palpation by himself، يعني ممكن يقول عندي can palpate this nodule، or يكون في swelling also can be palpated by the patient. يعني إذا the patient present with painless nodule or swelling، يعني بحس إنه في شنو lump of the testes. Then the clinician examines the patient. الexamination المعروف ده بالإنسبكشن والpalpation وممكن percussion وفي others طبعا for the test for the scrotum يعني. By palpation the clinician may palpate the tumor by palpation. Then the ultrasound should be performed for assessment of these testes for and it can demonstrate this tumor by the ultrasound. هنجي نوضح كيف this tumor may be appear. طيب بعدها احيانا ممكن او you have to do abdominopelvic and chest CT ليش؟ for the staging. يعني دايما before starting the treatment you have to stage the tumor. لازم نعمل شنو؟ abdominopelvic and chest X-ray، يعني abdominal and pelvis and chest CT، يعني نشوف الديستال metastasis for the bone and for the lung and the so this is done for staging before starting the treatment. طيب احنا زي ما قلنا هنجي نعمل ultrasound إذا كان السيمينوما appear as hypoechoic homogeneous sharp margin. إذا كان السيمينوما ممكن appear as homogeneous hypoechoic of sharp margin or seminoma non-seminoma of different size of echogenicity ودائما بتكون inhomogeneous or heterogeneous. And this seminomas may be calcified or it shows أحيانا بنشوف cystic lesion. إذا السيمينوما بتكون hypoechoic homogeneous with sharp outline with regular smooth outline. لكن السيمينوما أحيانا بتكون non-seminomas بتكون شنو variable echogenicity. ممكن تكون hypo or hyperechoic with heterogeneous texture and it may show calcification or cystic component or cystic change. طيب احيانا برضه في الالتراساوند ممكن نلقى calcification microlithiasis or microcalcification. This is calcification بتكون small microcalcification هنيجي نتكلم عنه برضه. and this calcification احنا بنخاف منه لانه هو usually precursor of carcinoma and this calcification appear as star sky appearance. هنيجي نوضح لكم في صورة star sky appearance لأنه في stars in the sky appearance. microlithiasis نحن بالنسبة لنا مشكلة on the microcalcification in the testes because it is the precursors of carcinoma. CT طبعا بنعملها to شنو for the شنو assessment of the metastasis in the lymph node or retroperitoneal lymph node or يعني other region lymph nodes اللي هي aortic والبارا aortic والaortic cavern. إذا the CT not done for the يعني testis itself for the شنو الليمفادينوباثي. زي ما اتكلمنا قلنا هنعمل السي تي for the abdominal pelvis and for the chest, also for شنو for the lymphadenopathy and the شنو for the secondary in the bone مثلا. برضه you have to do also you have to do شنو CT or MRI for the skull or the cranial CT or MRI. ليش؟ لأنه برضه to assess the شنو distal brain metastasis. because يعني السينوما can be metastasized to the شنو brain. And to conclude this is the patient suspected uh, tumor سيمينوما or non-seminomas tumor. نكون عارف السيمينوماس هي بتكون smooth outline hydrocoid and homogeneous، لكن النون سيمينوماس دي عندها different appearance. احيانا بنلقى المايكرو كالسيفيكيشن تعرفوا انه هي is a precursor of carcinoma، والابيرنس بتاعته تكون ستيري sky appearance. CT and MRI for the chest and the cranial done for assessment of the lymphadenopathy or secondaries in the bone or for the the brain. This is lesion, smooth outline hypoechoic. ليش قلنا hypoechoic؟ لأنه this is a normal لكن this is abnormal. فهي hypoechoic compared to the normal tissue, other normal tissue. But this is hypoechoic, rounded, well-defined lesion. But this is a seminoma, or this is a seminoma. You can see the hydrocele. This is the hydrocele. But this is the ultrasound for the scrotal ultrasound misses the testes. You can see what is this? What are these? Hypercoidia. AD.
هذا السمول microcalcification.
Yes, thank you. This is a microcalcification, stair sky appearance. Stair sky اللي هي قلنا precursor for the carcinoma. But you can see also there is a lesion here. There is small seminoma, which is well-defined hypoechoic with microcalcification or specks of calcification. But this is a seminoma. And you can see there is a hydrocele. There is a fluid. طبعا عندنا حاجة اسمها burn out testis tumor. دي tumors يعني usually discover هي testicular tumor with periaortic lymphadenopathy or retroperitoneal lymphadenopathy. لكن this condition usually we discover the lymph node before the testicular tumor. يعني البيشنت ممكن نجي نعمل له التراساوند نلقى الليمف نود، لكن ما الا نمشي نعمل testicular scrotal ultrasound نلقى الليجن in the testis. فusually we discover شنو lymphadenopathy, periaortic lymphadenopathy or retroperitoneal lymphadenopathy, and then when we do scrotal ultrasound we find this small epidemic intertesticular tumor or lesion. So this is called burnout tumor. فالبيشنت بريزنت with metastatic retroperitoneal lymphadenopathy، لكن البرايمري ما بكون معروف. البرايمري اللي هو شنو testicular tumor. فلما نلقى retroperitoneal نجي نعمل scrotal ultrasound نلقى this lesion. So this burn out tumor characterized by what? Oncogenic intertesticular lesion with retroperitoneal lymphadenopathy. لاحظوا this is left kidney, right kidney, this is aorta. درجة أي سيمة بتلقى هنا this is a soft tissue density, this is a lymph node. هنا there is a lymph node. دي كلها lymph node. Please go and look to the CT. Again, this is a normal aorta. لكن this soft tissue density, this is all these are lymphadenopathy, very aortic lymph nodes اللي هي retroperitoneal lymphadenopathy. فسو this is شنو بيسموها burn out testis tumor characterized by intratesticular oncogenic tumor. oncogenic لأنه أبيض oncogenic tumor with retroperitoneal lymphadenopathy. طيب تكلمنا قبل شوية عن الستار سكاي appearance. هذه الستار سكاي appearance اللي هي ايش؟ testicular microcalcification or microlithiasis. All these are small calcification. Okay. لاحظ إن هي شنو hypericide without شنو posterior aquatic schedule. لو متذكرين الستون في أي مكان بيكون hypericide عنده posterior schedule، لكن دي ما عندها posterior schedule. ليش؟ لأنه small 1 to 3 ملم. أي calcification إذا كانت يعني less than 3 في الغالب ما بيكون عندها shadowing. this بيسموها non shadowing calcification. So this is the calcification. Microcalcification range between 1 to 3 millimeter in the testes. قلنا دي بنخاف منها ليش؟ لأن هي as a precursor for malignancy. This is microcalcification in this, testes, testicular microcalcification. Like benign prostatic hyperplasia, PPH, right? Prostatic hyperplasia. عارفين this is the urea bladder, and this is prostate, surrounding this, the urethra. When the patient present with the يعني هي common in the elderly, this is enlarged prostate, and it is diagnosed when the prostate volume more than 30 centimeter cube. And in this time, the central part of the prostate may be enlarged. طيب how to diagnose؟ مع البيشنت بيجي أول هنا أغلبهم بيكون elderly، بيجوا ب urinary symptoms, urgency, frequency, burning micturition. ممكن يجيك ب burning micturition، and sometimes with urine retention, and sometimes with chronic renal failure. أحيانا بيجي ب chronic renal failure أو symptoms of urinary outlet obstruction، يعني يكون في شنو retention of urine. How to diagnose this؟ طبعا هيجي البيشنت بالسيمتوم دير، the urologist history examination، منها general examination، منها rectal BR examination to palpate the prostate. Then the ultrasound should be done, transabdominal and ultrasound, transabdominal ultrasound to assess the prostate. And in transabdominal ultrasound should be done if there is a يعني indication for the or suspected benign prostatic hyperplasia to assess the size of the prostate. What are the signs or radiological features of benign prostatic hyperplasia؟ أول هنلقى volume of the prostate increase, total volume when more than 30 centimeter cube. هنعمل assessment or measuring of the volume of the prostate هتكون more than 30 centimeter cube. Then elevated postvoiding residual urine volume. ايش يعني postvoiding residual urine؟ اللي هو we ask the patient to urinate to evacuate his bladder. نقول له امشي evacuate your bladder. زين بنعمل له scan again، هنلقى انه الريزيديوال يورين still يعني very يعني the amount of urine is still يعني كثيرة. So this is بيسموها increase postvoiding residual volume or urine. postvoiding residual volume بيكون elevated. نحن بنعتبره significant إذا كان more than 20 centimeter cube. يعني بقول لها امشي urinate يعني evacuate your bladder. still نلقى البلادر كأنه ما حصل لها أي evacuation. فدي طبيعة sign of benign prostatic hyperplasia. أحيانا البيشنت ممكن نلقى عنده signs of bladder outlet obstruction، لأن البيشنت وعنده obstruction of the urethra or outlet يعني، فبتلقى البلادر ديت trabecular thick wall، واحيانا نلقى hydronephrosis dilated ureter or kidneys due to back pressure. دي بيسموها urinary outlet obstruction، signs of acute urinary outlet obstruction، يعني في obstruction in the outlet اللي هي characterized by نلقى urinary bladder thick wall trabeculated plus or minus hydronephrosis. These are the signs of benign prostatic hyperplasia by ultrasound, by transabdominal ultrasound. الترانسريكتال التراساوند ما بنعملها اذا especially for the initial evaluation of benign prostatic hyperplasia. يعني اذا كان we are sure انه this is a benign prostatic hyperplasia، يعني ما بنحتاج انه نعمل ترانسريكتال. لكن اذا كان في suspected انه it could be في malignancy, this time you have to do transrectal. يعني for benign prostatic hyperplasia, transabdominal ultrasound may be quite enough to diagnose this condition. فلذلك الترانسريكتال ultrasound indicated if there is suspicious of malignancy to evaluate the prostate and to take a biopsy. زي ما اتفقنا من قبل انه شنو انه this transrectal ultrasound done for شنو for taking a biopsy, identity taken biopsy. Also, on the transrectal ultrasound, the bladder, the prostate shows, enlargement prostate. So, what is this image? What is this? Is it CT, MRI? What is this?
Ultrasound.
Ultrasound. Yes, thank you for what? Ultrasound of what? What is this? What is this? The cranial ultrasound is ultrasound for which part?
Transabdominal.
Yes, transabdominal ultrasound for what? يعني عملناه في ايش؟
For prostate.
Yes, for the prostate. You can look and see this is prostate and this is the urea bladder. This is the bladder, this is the urine, this is the bladder. And this prostate is enlarged. Prostate is the medial lobe which is projecting within the urea bladder or pushing the base of the urea bladder. إذا عملنا measuring to the volume of this prostate, it will measure more than 30 cc, centimeter cube. So this is benign prostatic hyperplasia or hypertrophy. There is a diffuse enlargement. There is no focal lesion. يعني هو كل there is no focal lesion. يعني إذا في focal lesion بنقول إنه مثلا could be malignant. This is 75-year-old male with retention of urine. This is ultrasound, transabdominal ultrasound demonstrates the enlarged prostate with which pushing and projecting within the urea bladder phase. This is benign prostatic hyperplasia. لاحظوا انه this is transrectal ultrasound. حتى البلادر ما بتكون ما بتكون full. The area of the urea bladder. لكن the transabdominal bladder should be full. This is the prostate. You can see there is calcification. There is a hypertrophy of the prostate. The prostate enlarged. This is the prostate with specks of calcification. Also, this is a transrectal ultrasound. But you can see there is a focal lesion. يعني في منطقة معينة فيها lesion. This is a focal lesion. Irregular outline hypoechoic. يعني هي سوداء مقارنة مع الأزر normal part. But this is the carcinoma of the prostate. لكن هنا diffuse enlargement of the prostate. ما في focal lesion لكن في calcification in the prostate. Calcification in the prostate ما بنخاف منها، بنخاف منها calcification in the testicle. لكن prostate calcification يعني ما منها خوف. طيب what is this? What is this?
CT.
Yes, CT. Which plane? يعني this coronal, sagittal, axial. Coronal or sagittal or axial?
Coronal.
Yes, coronal. What is this?
الكدني.
Which one? Left or right?
Left kidney.
دايما against your left hand is the right. This is the right and this is the left. This is right always and this is the left.
right kidney.
Yes, and what is this?
Liver.
Yes, and what is this?
Liver.
Yeah, what is this? Actually,
البلادر.
Urinary bladder.
yes, and this one,
prostate.
this prostate. Look to the right kidney. There is a mild increase, dilated upper ureter, and also in this one there is a right upper ureter dilated. And this is due to bilateral hydronephrosis due to urinary outlet obstruction. This enlarged prostate عملت لنا obstruction in the outlet. دايما البروستات لانه بتعمل bilateral ليه؟ لانه هي بتعمل obstruction in the level of the urethra لذلك بتعمل bilateral. لكن اذا كان عندنا مثلا any tumor or any cause for unilateral فبيعمل مثلا right or left. لكن when there is a bilateral hydronephrosis we suspect urinary outlet obstruction. يعني لما نقول urinary outlet obstruction اللي هي شنو؟ at the level of the يعني after the urea bladder يعني at the level of the شنو urethra. But this is a bilateral hydronephrosis. So this is a urinary outlet obstruction causing by the enlarged prostate. Enlarged prostate. And what is this examination؟ ده بنسميه ايش examination؟ طيب this is a contrast examination or non-contrast؟
non-contrast.
non-contrast ليش non-contrast؟ نحن لما نقول contrast examination معناته انه حطينا البيشنت contrast. Do you see any contrast in this patient؟ يعني حطيناه صبغة.
no.
طيب ليش دي ظاهر كده hypertense اللي هي opaque or hypertense؟ يعني ما في contrast دائما في اي مكان بالشاف as يعني شنو bright or white. يعني الصبغة دائما بتكون وايد according to the area. إذا عديناه في الأسوفيجس أو في الباريم ميل باريم أني كلها بتظهر لك كذا opacity or opacity like this. But this is a contrast given IV and you can see the contrast filling this, What is this?
Ureter.
Yes, and what is this? هي دي كلها كده دي the urethra matter. This is a kidney. This is a calyces. This is a minor and major calyces. This is a pelvic. This is a renal pelvis. And this is the urea bladder. And you can see there is a filling defect. المنطقة دي حصل pushing of the prostate to the base of the urea bladder by enlarged prostate. This prostate pushing the base of the urea bladder. ظهرت لنا as a filling defect. But this is a IVU, intravenous urography or IVP. You can see there is, dilated ureter and pelvic calcium system يعني right hydroureter and hydronephrosis. due to enlarged prostate due to enlarged prostate. So prostatic benign prostatic hyperplasia can cause hydronephrosis. hydronephrosis. What is this? What is this image? idea. If we can be هنا CT this is MRI. Why is this CT and why is this MRI? ليش دي CT ما كانت تكون MRI؟
في bone appears
Yes.
brighter.
Yes. Hyper إيش؟ hyper
Hyperden.
dense, yes. But density on CT, hyper dense. And the ball here is how the ball appear here. black يعني hypo intense or of no signal يعني of no signal يعني black. But this is urea bladder and this is prostate and this is the rectum. Also this is the rectum and this is the prostate. احنا بس جبنا الإيمج ديت to know this is CT and this is MRI and how the what is the relation between the rectum, urea bladder and prostate. But this is the axial and this is axial, this is CT and this is MRI. Last slide. This is a patient known case of prostatic malignancy. What is this exam or what is this study? ايه دي الصورة دي ايش؟ Ultrasound, CT, MRI, what is this? Any volunteer, what is this? What is this image? What is modality used to perform this image? اللي عملت بإيش؟ CT, MRI or what? Ultrasound, what? What is this idea? Or this and this and this. Well, these are the vertebral bodies. Vertebral bodies. Which one? Is it cervical? Is it which one vertebral? Yes?
Nuclear.
This is a lumbar vertebra. This is a lumbar vertebra. So this is a what model? This is X-ray. This is X-ray. Which view? بقيت تشوفوا الستراكشر دي الفيرتبرال بودي. Vertebral body. Lumbar vertebral. It's number 5, L5, L4, L3, L2. This is L1 and this is sacrum. Lateral view. Lateral view. طيب how to describe this abnormal? This is abnormal vertebra. How to describe this abnormal vertebra? Description. يعني what do you see يعني?
Maybe it's Carter.
لا أنا مش داي diagnosis يعني to describe يعني نصف abnormality.
Become dense.
Yes, it becomes dense or sclerotic. يعني because this vertebrate becomes dense or sclerotic compared to the other vertebral body. طيب how to explain this sclerotic vertebra or dense vertebra? Why this vertebra become dense or sclerotic? What is the cause of this sclerotic or dense vertebra? Yes. Fish, bigger hyperdense or sclerotic. Please go and read or يعني the clinical presentation. The patient is a known case of prostatic malignancy. So why this X-ray demonstrates this hyperdense or sclerotic vertebra?
Because of the metastasis.
Yes, the metastasis. حصل له metastasis, sclerotic metastasis, prostatic malignancy, the common cause of sclerotic metastasis. يعني زي ما اتكلمت في المذكرين كان عندنا ليتيك ميتاستاسيس اللي هو بيكون اسود، لكن this is sclerotic metastasis. Prostatic malignancy is the common cause of sclerotic metastasis. What is this exam or this study? It's X-ray.
radioisotope.
Yes, this is radioisotope. How to describe the abnormalities? These abnormalities. Also, this is the same patient.
Increase uptake and
Yeah.
activity at the
Yes, there is increased uptake, increased activity. So also this is one of these causes of increased uptake is secondary or metastasis. So this is a metastasis due to prostatic, malignancy. This patient develops this, hyperactivity or increased activity. Do you have any question or any comment?
Thank you, doctor.
Thank you, doctor.